September is National Suicide Prevention Month. According to the CDC, one person dies by suicide every 11 minutes in the U.S. But experts say that raising awareness can reduce the stigma and spread hope for this very important topic.
Dr. Ashley Zucker, a psychiatrist with Kaiser Permanente San Bernardino, is here to talk about some of the warning signs that people can look out for, because, you know, I'm seeing a lot of videos pop up because it is Suicide Awareness Month of how this father committed suicide 3 days after this amazing video with his family and that type of thing. But there are specific things people can be looking out for.
Sure, certainly. I mean, sometimes it can be very hard to tell and people will hide a lot of things, but some of the kind of key things to look out for are certainly if you notice big changes in their mood or their behavior, if they start giving away a lot of their possessions, if they start saying goodbye to loved ones, really starting to isolate, maybe even engaging in much more risky behavior than they normally do, where there's sort of more risk of death. Those are some of the key things to watch out for.
And of course, education, the things you're teaching us about now, raising awareness, is so important to helping cut these numbers down. But that stigma around suicide still exists. We talk about this all the time. As many people struggle with it, it's still really hard to talk about.
Absolutely. It's very hard to talk about, and that's actually one of the key things to reducing the stigma, is to talk about it, right? So the more we have these conversations, the better it is for stigma. And I think one of the key things to think about too is that when you talk about suicide, you're not necessarily increasing the risk in any way. It actually can open that door for people to seek help.
I think that's really important for society, but it's also important for us in news, because there was a long-standing idea that if we discussed it, or if we discussed the warning signs or talked about certain cases where this happened, that it would increase the amount of suicide. But the statistics have proven that that is not the case.
Well, I think there's a little bit of a balance there. So certainly asking someone, are you having thoughts about killing yourself? Are you having thoughts about ending your life? There's no risk there. When we start to get into a lot of the details of situations where people have died by suicide, how they did it, that can be a little bit of a tricky situation.
Interesting.
But certainly talking about it, asking about it, that's all perfectly safe and actually very much encouraged to do so.
So having informative conversations, not really the salacious, gory details
of
these
yes,
cases. Okay.
Exactly.
This is always interesting to me. Suicide rates higher among men, 4 times higher among men than women, but suicide attempts are higher among women.
Absolutely.
Explain those numbers for us.
Sure. So we do see that suicide rates are higher among men, and those attempts are actually higher among women. And the difference there is really that men are more likely to use lethal means when they're making their suicide attempts. Also, men are much less likely to seek out help. And so, of course, that increases rates there, too.
That's why I thought the quarterback for the Bears, having his nails painted, being in such a masculine position, being able to raise awareness there, does that help too when you have other men step up?
Absolutely, yeah. I think it really, really helps when people see people like them, you know, that really are speaking about it, open about it. I think that does really open doors for people to talk more openly.
Do we know why women are attempting suicide more than men?
I think it's for very similar reasons. I can't say that there's a difference in terms of what causes the, you know, thoughts of suicide. You know, I think it's a lot of just societal pressures, financial pressures, relationship pressures, work stressors, and certainly just mental illness in general.
So this is always the tricky part to me, because, you know, we have done reporting in the past of people who have died by suicide, and a lot of times family and friends go, I never saw it coming, or, well, they did have depression, but I thought that they were being treated for that, or, you know, I hadn't called them in a while, maybe I should have done. What are the specific things that you can do as a friend or family member if you think someone might be in trouble without triggering them?
I mean, again, just asking people how they're doing is really, really important, and asking it in a very sort of non-judgmental, you know, way, and just kind of, hey, I noticed that things seem a little bit different, or you seem a little bit off. Are you okay? Can I help you with anything? Those types of conversations are really critical.
And sadly, I think we talk about this all the time, that we have these conversations with people who are close to us, and so many people do. So what if they do say, yeah, actually, I am thinking about suicide? Then what do you do?
Absolutely. So if they do open up to you, which hopefully they do, we want that. You know, there's a couple of things. If you feel that they might be at, you know, imminent risk, then the suicide hotline, the 988 number, is critical. And sometimes actually calling it with them can really be helpful too. So kind of holding their hand through the process as opposed to just handing them over the number. If you don't think that there's like an imminent or immediate danger, then it might be just helping them connect with their primary care physician just to get started.
That's really interesting. I would never think to call with somebody, but that would be so much more powerful. The person
Right.
would feel probably more supported in that
Absolutely.
way.
And then you feel supported, because I think that's a
Right.
lot of weight to know that someone you love has confided in you, and now you're like, I want to do everything right, but what
Right.
do I do?
Right, especially when you feel like I don't know how to help, or
Right.
I'm scared, I want to help them too.
Yeah, well, this is very helpful information. Dr. Zucker, thank you so much for coming on for this important conversation.
Thank you so much for having me.
Of course.